Okay, hi, my name is Dave Stanton. I have an order to give Humulin NPH, 100 insulin, U100 insulin, 20 units subcutaneous before breakfast, and Humulin R U100 insulin subcutaneous per sliding scale, twice daily, 0700. 0700, my patient's glucose was 245, and on his sliding scale, 245 puts him at 10 units. This is Skip Rocker, 1/1/1972, type 1 diabetes. The doctor is I am Jumpy. So what I'm going to need to know is I'm going to be able to give the right patient, Skip Rocker, the right medication, Humulin NPH U100 insulin and Humulin R U100 insulin, the right dose, 20 units of NPH, and on the sliding scale, 10 units of regular insulin, the right route, subcutaneous, at the right time, before breakfast, 0700, with the right documentation. And I have the order, I have the MAR, I have my medication. So I would check my medication. For these purposes, this is going to be my regular insulin. And so it would be clear, has not been opened, or if it had been opened, that it was appropriately initialed and dated, and that it was good for 30 days after it had been opened. But for my purposes, this hasn't been opened, tampered with, any of that. Same thing, this is going to be my NPH, that's my regular, so this is going to be my NPH cloudy. It hasn't been opened, tampered with, everything looks appropriate. So now I'm going to verify that for my second check against the MAR. Expiration date's good, cloudy. Expiration date's good, clear. Hasn't been tampered with. This is the Humulin R U100. This is the Humulin NPH U100. Looks good. The amounts are great. So at this time, I'm going to make sure that I have a clean surface for my prep work. So I'm going to clean that off. Going to flip the tops on my insulins. I'm going to use a different microbial pad for each one, antimicrobial swab. So now that I have to mix these insulins, better do some hand hygiene. Hand hygiene's done. I'm going to open my equipment, being sure that I do not contaminate the needle by touching it inappropriately. So I know that I have to give 30 units total, 20 units of the NPH, 10 units of the regular insulin. So I am going to insert my air into these so that I can mix them appropriately. I'm going to use the double OK method. I am going to have 30 units total, so I will draw back 30 units. There's 10, 20, 30 of air. So in order to mix these properly, I am going to insert 20 units of air into the NPH insulin, which I said was this insulin. So I'm going to insert, making sure that I am not touching the liquid. So there go my 20 units there. Now I'm going to insert 10 units into my regular insulin. And now I will withdraw 10 units of regular insulin. Great. And I will withdraw 20 units of Humulin NPH. Excuse me. Okay, so I'm going to verify that I have that. There are no bubbles. I'm going to one hand scoop. Okay, so now I am ready to see the patient. So I would see Skip Rocker and get his ID band. I would check his ID band and ask him his name and date of birth. Skip Rocker 1/1/1972. Do you have any allergies? Celebrex will not preclude the administration of this. He weighs 185 pounds. It doesn't give me a height, but with his type 1 diabetes, I'm going to assume that he's obese. Let's say he's obese, so that's going to affect the angle of administration. So I will be going 90 degrees. If he were not obese, I could go at 45 degrees. So I've got all that. I'm going to give a subcutaneous injection on the left side. I gave one on the right side of the abdomen. I'm going to go an inch away, at least an inch away from the umbilicus, and make sure that I'm in the subcutaneous. I'm going to check that site and make sure it's not hard, make sure that this has been rotated, make sure that he prefers it there. I could give I could give this site in other I could give this medication in another subcutaneous site, but for the purposes of this, we will use the abdomen. I believe that that's fine. Okay, so now I've done my third check, but I'll do it again. I don't know if I verbalized it. So I've got 30 units. I withdrew 20 units of NPH and 10 units of Humulin R. The expiration dates are good. My patient's allergies are good. I've got the right route, the right dose, the right medication, the right patient at the right time with the right documentation. Okay, so I'm going to do some hand hygiene. Apply clean gloves. And I am going to remove these gloves. Without leaving the patient's bedside, I am going to call for a nurse. I should have done this before I came in here, but I'm going to have another nurse come in and verify what I have done, verify these doses and verify this insulin so that this is done correctly. Now I will hand hygiene. My nurse has verified my doses. I will take my alcohol prep pad on the chosen site. I'll have the patient positioned properly, leaning back so that I can do this. I will start at the center and work my way out. I'm going to allow that to dry before I administer. I will use the double OK method. I will pinch the skin so that I get that subcutaneous tissue, but I do not go beyond it. We said the patient was obese, so I would go at a 90-degree angle. I could go at a 45-degree angle, making sure that my bevel was appropriately placed, but I'll go at a 90-degree angle. I will go in. I will deliver my medication. I'll wait for a second for that to go in. I will withdraw and release. One hand scoop. Into the sharps. If I needed to, I could get gauze for my patient using gloves if I needed to, or a Band-Aid. And then I would do hand hygiene. I would note in the MAR the location and the dose and the time of administration so that this could be documented properly. I would make sure there were no reactions for my patient per hospital policy, and then I'd make sure the call bell's within reach. I'd clean up my area, and I would go ahead and conclude this administration. Thank you.